I would like to know, since we are in UAE, the role of UAE government in encouraging the development and adoption of innovative healthcare technologies. And are there any specific policy initiatives that have been, effective in getting this done? So, Mr. Rizwan, if we could begin with you.
Well, thank you very much for that question. I think that um, I think the previous panel actually touched on just a few things, including if you have an aspiration for um, the kind of data-informed healthcare sector, we first of all need to make sure that the healthcare sector can speak to each other.
Right.
The UAE government has been very proactive, right at the leading edge of laying down regulations, not only for technology, but also for information standards. One of the many things that PureHealth does is it runs the federal level health information exchange. And that is what enables the health information of a patient sitting at any one of our hospitals to be accessible if a patient shows up at any one of the other hospitals. Obviously, that can be done with a defined data set. That and a number of initiatives where we feel that the government has done everything and is doing everything to set the progressive agenda for how innovation can help the healthcare ecosystem.
Perfect. Mr. Kafle, if you have anything to add there.
Yeah, I think I agree with Mr. Rizwan. So we operate into UAE, so majorly in the Dubai and Sharjah we have a presence. So so I have a very good comparison, right? So I started taking care of the Oman region now. So when we compare the Oman versus the UAE, right? So where we are sitting today. So I think from the DHA or even the MH, right? So we have a we have a lot of opportunities, right, where the digitization or the innovation we could actually do into this region.
Perfect. Sure, please.
Actually, before we do that, can we just get the door closed? If
Yeah,
I can
sure.
hear the noise outside,
Absolutely.
nobody can actually hear us.
Definitely, sure. Thank you so much. Thank you.
So as Mr. Rizwan
Can we have the volume up, please? Yeah.
added about itself, starting HI is an innovation in UAE. So the way we operate Zulekha Hospital in Sharjah as Northern Emirates and as well as DHA, so Dubai. So if you see, we have Navid and we have worked on ARP. So that's the unified HI which we have started, and that's actually a very good initiative. What we saw, and in daily these things, patients are also getting benefit, doctors are also getting benefit of this HI things.
Wonderful. Anybody else would like to add to that point, or should we move ahead? Yeah.
I think going back to what you asked, the question on regulations, one thing I can see is the region always keeps up to date with all the regulations. So very recently, they even updated their, let's say for telehealth, because I was having a discussion with DHA, and unlike what it was 3-4 years back, they mandated HIPAA as well as ISO 27001 as a compliance if you need to get your telehealth platforms accredited or certified for use. So you don't get a telehealth license unless you have this, which was not the case a couple of years back. So yes, they keep updating, and even for AI, they have actually come out with regulations saying that any AI introduced in the healthcare should be first taken an approval from them. So there are regular updates, and I think the speed of updating the regulation is one thing which they're really definitely good at. Yeah.
Right. So, gentlemen, we are talking about getting the most out of AI and of course big data and healthcare. But one of the primary concerns that is there, that how do you as leaders ensure that the optimal ethical standards are maintained and the patient's privacy is respected? So, Mr. Gaurav, if you could like to add to that.
So, well said.
If you could get the mic. Yeah.
Yeah. So, this is a very good question. So, I would like to say over here that AI has taken a very good insights into the healthcare. And if I talk about AI implementation, with their ethical standards, we as analytical and technical leaders must follow the ethical standards while we are implementing the AI technologies, while we are developing the AI technologies. So these things matters a lot for us. Uh, if I talk about the principles and frameworks which we are really following, it is must that we follow them religiously, because once your system is developed, then it has to be a foolproof without any issues. So if I talk about further healthcare providers, we must involve them in building all these AI systems. They are getting good benefit out of it, no doubt in that part. But while developing these systems, their involvement is must, because their directions and inputs can only make the system as best and with maximum efficiency, I would say. So this is how finally I would say that privacy, if we talk about uh, patient privacy, patient data privacy, it matters a lot. We must follow the compliance, we must follow the law of the land, right? And data governance rules. These matters a lot while we are developing these systems. As if I talk about ethical, hackers also, you must know that they are 10 times ahead always. So they have also developed their AI systems. So they will easily enter to your system and they can steal the data. So that's why when you're developing it, at that time you must have a proper understanding and proper testing of those systems. Then it is easy to go ahead.
Right. I'd like to, have a thought of all the leaders here. So, sir, if you could.
Yep. So data is power, today's world.
Right.
And with great power comes great responsibility. So it's very important how we use the existing data, not only in terms of historical, but how do we make this consumed in terms of predictive and prescriptive analytics too. And coming to AI, I think Gaurav just briefly touched upon this. AI is a fancy term being used everywhere. We have to be cautious of where we use AI. We just cannot use AI in every aspect of healthcare. We have to be cautious on where, how, what's the right time of introducing AI, and how we're going to monitor this and course correct based on the outputs that we get from AI. Now, I do understand that on a broader perspective, as technology leaders, AI is advanced in other industries, but maybe my peers would agree that in healthcare, there is still a lot of scope for us to mature and advance before we can completely start talking about AI. And when it comes to machine learning, that's a completely different aspect to data analytics and AI. And while some of the firms are advanced in let's say piloting machine learning and AI, at the moment I don't believe we are at a very mature state in introducing this in terms of replacing any healthcare practices. By the government, the laws perspective, internationally, yes, there has been some flexibility in adoption, while again the governments are reconsidering the laws that they had introduced during COVID and just post-COVID. So they are reconsidering, they are recalling a lot of laws where flexibility was given because of the pandemic. So the governments are reconsidering some of these laws as well, and we have to adhere and comply with those laws too.
Right.
And just to add on, I think on what both of them said. So I think one of the things as private entities, I don't think, first of all, we have enough data to do actually AI on top of it. So we talk about the bigger programs like Navid and Riyati, which is at the government level. Yes, they do get all the data, and I think that's where that will happen. So that's one. We end up using AI as consumers, what are developed by others, most of the cases, and specific areas like Himanshu mentioned. We need to really look at where the value comes in, and we pick up certain AI tools which can be used to leverage certain processes or certain pains that we have within the organization. Now, what we need to look at that is, how is that, what is the base of that AI build? And that's one. Second thing is how transparent are we with our customers, whether it be patients or whoever is the stakeholder in that, in terms of where we're using the AI. So now, for example, or even any of these, the single patient record the government has, there are 3 of them in the country. All of them has a real opt-in and opt-out option at the beginning, and the patient needs to know about it. So I think that's key. If you're using the data for anything else, I think patient needs to know about it, right? Of course, you have the option of using the data without the patient details, but then you need to get into that details with the vendor that you're working in to figure out if that's the way you want to do it, right? So there's a lot of things on top of the regulations that you need to be careful when you engage into an AI or on a big data. And second is who gets access to the data. So data, it's not only now, even before AI, it's always access based on need, and it's not access to everybody, right? So we need to really be careful of that. Yeah.
Very true. Access based on need. Yeah, very rightly said, sir. Yeah.
So just to add in the final point. So I think everybody has the valid point. In my opinion, right, the AI, so now we used to talk about the large language model. Now even the small language models are available in the market. So more than the regulatory point of view, I think it is our ethical, we should understand our moral responsibility, right? So we need to first choose where we really want to use the AI. And in those areas, obviously we need to control the data, right? So if it is our responsibility to, they share the data where the PHI is not violated, right? So the patient health information has to be, the controlled by the provider. So obviously the big data or small data, I think it is first of all our moral responsibility to share the data either with the vendor or you develop yourself, right? So when you are using the data, you should be very much careful to avoid the PHI.
Right.
Just to add
Sure.
what exactly my colleague said. So, all depends on your business operations and business life. So if you talk about healthcare, we have 2 parts. One is called as a clinical and one is non-clinical. So yes, non-clinical, no-shows and all other different problems what we have, we may use AI, but when it comes to clinical, we are dealing with life. So we cannot just, so as Himanshu said, there is 3-4 years more to mature and come on that accuracy point where doctors can rely what exactly the AI is.
Yeah, Mr. Tufail, your thoughts on this?
So I'd love to pick up on what Aliasgar just said. I absolutely agree, and I think one of the previous panels talked about healthcare, about AI applications in the clinical realm or the operational realm. I personally think that we absolutely need to be clear that the AI applications, and trust me, we are actually using them, and I'll speak about that. We need to start on the operational side. I think there are a number of reasons for that. Number one, we need to build trust as us as technology leaders as well as business leaders in the quality and the reliability and the trustworthiness of the data. Number two, it isn't a technical problem. It is actually a people, and it isn't a problem. It's a people issue. If I can just pick on a personal narrative, my father was an orthopedic surgeon, and at some point after he'd retired, I was speaking to him and I said, "So easy to do Skype. Why don't you?" And he said, "Well, you've got to remember, when I retired, we didn't have these things, and sometimes we're just a little impatient." This is a people behavior change narrative. I think that the idea of will we use AI for diagnostics is actually the wrong question. It's a very dangerous question because it actually just gets the guard up. Reality is, right now, we are using AI. In a number of the EHRs that many of us are using, there is the ability for speech transcription. There isn't a magician sitting there. There is an algorithm that is doing that. Reality or point is that we are using AI. We've just got to be really strategic, really thoughtful on where we will use those applications. It doesn't always need to be a model that you've developed in-house. You can actually buy technology. It should be driven by need, and it needs to raise all of the boats at the same time.
Yeah, I just agree with you on that. I think I just want to add one more thing. I think there's people as well as data quality issues that we have in healthcare. So why radiology is being more adopted, or they're more mature, is because there's very little bias in data and change or data quality issues in radiology, because you're talking about images. That's not the case when you talk about patient data, right? We all know that a patient who is maybe wants to do a screening, because it's not covered in insurance, and the doctors tend to put them on borderline, but that's not the right data. Now, how do we know that it's not the right data? You apply an AI on top of that, you're going to get something wrong, right? So that's the biggest challenge that we have today in healthcare for using. It's not the tools, like rightly said. Yes, people adoption is one of it, but that's why we've started with processes, right? So we do have voice to text in our EMR, the example that we give. I think some of us has even the coding rules as AI engines going in the EMR. So these are operational things which help them, and that's the right place for us to start, to build that confidence that these are AI tools which helps them to actually do their work, right? Yeah, radiology, yes, a lot of us is doing it. That's one area which is more mature, but I think all the others are, like we all said, there's still a long way before we get there. Yeah.
Even we have so many for insurance, RCM. So we have so many algorithms inbuilt, even developed in-house. So that's, so in some or other way, we are using AI. But actually, again, just to see where exactly your business needs and where you can really going to use it. So that's very important.
Rightly said. So to add to it, if I say that, like I said earlier also, that testing of these AI, because first of all, your operations, what you need, then that you're developing in-house also, or let's say you're taking third-party, any software, but testing has to be proper, so that tomorrow you don't get into a negative picture, because AI is good to have, but you need to be cautious.
So, gentlemen, do you think while there may be challenges, in the adoption, or probably, adaptation, or probably, adherence to standards, or do you think there's still a need, or where are we, when it comes to getting educated about these initiatives, the AI initiatives, Is there a need, and what do you think? What are your thoughts, that where are we, and how far do we need to go to make, probably a uniformity come across the sector? So if I can open this question to panelists,
So education, I would say over here that much of education is required. Regular trainings are required for all the healthcare professionals how to utilize this AI. Because if you do not have a proper training, you may misutilize it, leading to some results which are not required. So that education is required very much. Plus AI, as it is into the market globally, into the healthcare also, I would say, as I said, testing thing. So after testing it completely, once the systems are ready, then, the final testing must be done by the medical practitioners without looking into the live patients, because it's about the patient's, treatment.
absolutely.
It benefits us in lot of terms, like, diagnoses are there. You will get faster reports. As we talk about medical imaging, it helps us, PACS integration, if you talk about with the AI, with cardiology, with the other specializations also. So integrations are good, but what outputs are coming, that we need to check first. So once those are successful and we are confirmed, yes, this is really giving us better, outputs and efficiency, then after that we can say, yes, now we are up and live with AI completely. So regular trainings, as I said, that is must before implementing and post implementation also.
Right, sure.
So maybe not everyone in the room is going to like me for stating this. I have attended numerous sessions in this industry, outside of this industry, in technology, and people really don't understand what AI actually is. And there is a lot of miscommunication, wrong awareness being spread by vendors, technology providers. So a simple automation, they call it AI. A report, which could be a simple descriptive analytics, they call it AI. Right? And this is giving wrong ideas and impressions for people who don't understand AI. And the problem, I think, for us is when our CFO attends one of this meeting and says, I want AI, it's difficult to explain to them that that is not AI. It's a simple dashboard.
Right.
And that's waste of their time, waste of our time. Rather, we use this. So going back to your question, how important is it? It is very important. Are we doing it right? Maybe not, because there's a lot of wrong communication and incorrect awareness being spread in the industry for whatever reason. Should we talk about it? Yes, but I think we should talk the right things to the right people and make them understand what actually AI is and what AI isn't. And then we can get into who should adopt it, when should you adopt it, and all the jabang after that.
Right.
Just to add, there is no actually written definition of AI. Yeah. So artificial intelligence, yes, artificial intelligence. I think we are using Siri and all of the things like, there are a lot of things we already have in our daily life also. But when you talk about specifically healthcare, we have not actually seen a very strong use case, right, of artificial intelligence where we actually really called as an, AI. So still, it's like, again, it's on mature, maturity level is not that much in healthcare specifically. And we are talking about imaging. Again, you cannot depend fully on that particular tools, because again, one most important thing which I feel, and I think human intervention is very much required when we are talking about healthcare. So you cannot completely go blind on AI thing. Just use it.
Right. So, but one more thing in this, right? There is a misconception of the AI, of course, right? But when you are putting a right AI into right place also in the healthcare, we talk the CDSS, right? The clinician decision support system. So we don't ask the system to take the decision. So system is always there to assist the physician, right? The physician is the right person to take the right decision, right? So in the awareness part, right, I think the understanding the user expectation first and setting our expectation to the users, right? So these are the two key parameters, I believe. When these two key parameters are right, then I think the adoption will definitely go into the right direction.
If I can just add a couple of things. So I respectfully disagree that we don't have healthcare applications. So let me give you an example. So I'll preface this by saying I don't know how many people know PureHealth. One of the entities that we own is also a large insurance company, Daman. In that, we are actively using analytics and AI for fraud, waste, and abuse detection. I think the point that we are making is we don't have a lot of use cases in the diagnostic and clinical side. That's perfectly okay. But we have use cases elsewhere. I'd love to pick up on the literacy or awareness building. I think that's actually the biggest challenge. And I think data and AI literacy is the kind of literacy that we've never encountered before. Let me give you an example. So unified, patient record. Yes, if enough data is there, that's where the actual AI on the clinical side will happen. And I totally agree with you. There are a lot of things that we all are doing, which is not on the clinical side.
Absolutely.
As Jaleel rightly said, it is about the change management. So that change is not just for us like ITs. It is the change management for each and every person in the hospital,
Yes.
Whether it is nurse, provider, finance, every department has to adopt that change management. Then it can be successful.
Right. And before I ask the panelists to give their final takeaway, any questions from the audience? Okay.
Hi, Dr. Abhay Chapata. I'm actually a surgeon. And thank you very much. It was a very informative session. A lot of the thoughts that you echoed, I will congratulate you because it's really important that you echo those thoughts. But one key point, healthcare is essentially a medical interaction which is supported by everyone else. We are talking here not a single person here as a clinician, and as a clinician, let me tell you where I see the problem. Our data is just not structured. We are depending on data that is coming out of clinicians, which is completely of a variable nature. And then we are trying to build analytics on the top of it. And I can tell you almost every analytic function in healthcare has been based on false data today. That's why we are not adapting it. There's a second problem. AI is known to confabulate data. Generative AI is known to create data of its own, and we are calling them AI hallucinations. So till we overcome challenges of technology in order to have some kind of dependency on it, clinicians will find it very difficult to integrate big data and AI in healthcare. So I just wanted to kind of add that perspective. But thank you very much. I found the entire session very, very helpful.
No, I think,
I would like to say over here, final verdicts is of the doctor only.
No, I think we did echo that. At least I did say that, if you look at the clinical data that we have, the biggest challenge today is, as you rightly said, the data on the clinical side. That's why we are not seeing a lot of solutions on the clinical side, but there are still things that are going on the research as of now in terms of how this can be structured. But before we structure it, there's also the question of the quality of the data itself, right? Now, are we sure that everything that is written is right first and written properly, and you've captured everything? If you're not captured, either you have a missing data or you have a wrong data in there, and then you structure it. So then comes the question of structuring. So we are still far away from structuring the data. I think we have not even answered the question of, is the data correct, right? So.
Okay. Yeah, sure.
This was spot on, and I'll tell you the answer lies in a paradigm shift. The doctor should not, or a clinician should not be a data creator. He should just be a data consumer. The day we understand that concept, we will address this basic challenge. But thank you very much. I completely endorse that.
From the clinician side, just I want to add, doctor, what you said. There is always human intervention is required. Human intervention, that is what our founder says, Dr. Zulekha, the magic of caring touch, which only comes from the clinician. Nothing can, that's what human intervention in healthcare is very, very important. Any technology you introduce, technology is there to help you out, to understand. So I'm sure all my colleagues will agree, we think as a clinician. We don't think as a technology. We first see how user is going to benefit, and the main stakeholders are the clinicians, right?
Yeah, just one more thing before we go on to the next question is, I think we are seeing more use cases in AI for wellness than for the treatment side. So, yeah. So.
Hi, my name is Atul and I'm a executive director at Doxy. First of all, congratulations. It was a eye-opener for people like us. At the same time, it would have been better for the people who are not from tech background. The best thing is, the question which I have for you is, when Peter Drucker calls hospital as the most complex, machine to work with, the IT plays a greater role in that entire machine to be oiled in a proper way. So I think one is, CIOs and CTOs taking the leadership position and, taking the entire management for the change management and making a kind of a positive vibe for people to understand the AI. Basically, one is, I completely agree with you when you said about AI and learning and, people to, give away with their myths and misconceptions about AI. But at the same time, there are so many pre-service, intra-service and post-service activities which are in the hospitals, which are not, AI is unfortunately misconceptualized as clinical consumption of AI. There are so many other aspects wherein there is supply chain is there is a data analytics is there, even there is the finance analytics are there. So what you guys as leaders should make people understand at the management level. So my question to you guys is, how that mechanism or how the strategy should be from you guys as alpha males or the leaders per se, to imbibe this kind of mindset that it is not for the clinical use only, but it is a paraclinical and non-clinical use. I think how you are going to handle it, that was the question.
I think this will be the last word from you.
Yeah.
All of us?
Actually, see, that's what I have mentioned before only, that AI we all are using in non-clinical side, and to get understand this to the management or to the top levels is only when you are going to show the ROI of that particular thing. So if you are going to show what you are going to get it and how your business processes are getting simpler when you are going to use AI, and the ROI is, you don't have to tell actually ROI also, you can directly show it when you are going to install that tools. So now everyone understands, everyone wants everything faster. So if you are going to change your business process more faster with this kind of tools, definitely I think CFO has to agree on this.
So I think, as I said earlier, I think if the what you need to start in your organization, if you really want to do that, is the first question is to the organization is, do you want to be a data-driven organization, right? And based on that question, you ask every department, what does that mean for you, right? So that's where it all starts. Like you said, for finance, it might be different thing. What they want to automate and what they want to look at it more would be more data, analysis and dashboards. Whereas for a different department, like we have an example we did for that for our laboratory now, or recently our standalone laboratory, the Premier Diagnostics, that's become a fully automated laboratory. So sample once collected is actually fully automated from the till resulted, right? So that made a huge difference for them for the turnaround time. There's a lot of things that is, for samples getting misplaced and a lot of other things. So and including a rerun of a sample. So if the sample, normally what happens is there are calibrations for the machine. It says that if you use the machine these many times, you need to rerun sometimes based on that calibration. So including, keeping at a staging place and recalling that sample if a rerun is required till the final result is done, and keeping that sample if the doctor orders any further tests on that same sample again for the next 48 hours is all automated, right? And calling it from that archive back if a doctor orders it again. So now this is a fully automated thing, and there's a lot of AI and other intelligence going into it. I wouldn't say pure AI, but again, there's a lot of intelligence going into it. So this is an area where if your organization decides to be a data-driven organization, there are a lot of things that there's one of the vendors sitting in this hall itself where we've done a lot of work with them in terms of automating my patients to, I think we had a presentation earlier, so we've already done that, where appointment confirmation is automated on a voice call, right? Earlier, this was a nurse's activity. So I've taken out a huge chunk of nurses' time to give it back to them to actually do what they do. I mean, they can do better with a patient than calling a patient on the phone for actually doing appointment confirmation. So that's an automation that we've done. So there's a lot of, and even that voice to text automation, there's AI at the back end of it running, right? So there's a lot of areas. So I again say you start with the organization to ask this question of, do you want to be a data-driven organization, and what does that mean for each and every department? That's where it starts, from my opinion.
So I'm just going to piggyback on some of these points. Right? So a big role of using data is not data science. It's understanding the business. If you don't understand business, data science is going to fail. So, and this was a problem probably a decade ago or 8 years ago, 5 years ago, where tech leaders were not directly being involved at board or at top leadership meetings, at operational meetings. So the visibility of an entire business, that system that you spoke about, the overall view was difficult to get. In the last 8 years or so, and maybe, I don't know, maybe it may be different from organization to organization, but I think for the UAE in the last 5 to 8 years has seen this shift where tech leaders are now being involved in operational decisions, are being involved in board meetings, are now being involved in group level discussions. That gives an aid for us to understand how this full system works, and how Jaleel gave an example. So we then understand what part of the system can we use to make it easier or simpler, or maybe oil it a little bit better so the entire system functions better. It's only after that we start bringing in data, we do data quality analysis, whether it's even worth doing it. Is the data good enough? So I'll give an example. There was an example of automated call system implemented in a very big bank in the US, which had AI and machine learning. Thing that they did not do was to put proper controls on the machine learning part. So there were some abusive calls from the customer that this machine learned, and the machine started to abuse because it read the emotion. The emotion of the customer was high, and the machine started to abuse the customer. Right? So that's what I'm saying. The next part comes on how do you oil this system is again important. And then we go further to understand what are the other areas where eventually you start spreading them. So that would be on your question on the strategy. First, understand the business, then understand the vision, then understand your readiness, then the possibility, and then implement. Without having all the prerequisites, just implementing, just because it's a fad, may not take you in the right direction. Right? So that, in my opinion, is a pretty strategic decision that needs to be taken collectively.
Yeah, so I love the question, and I think that one of the mistakes we may be making is we think of data as a technology problem. Yes, the IT teams are required to deliver the solution, but this isn't actually a technology problem. So much so that, and I understand that we as a 28,000 people organization have the muscle to be able to do that, but in our organization, we've got a completely separate IT department. It has nothing to do with the work that we do with data. I'm the chief data officer. We've got a chief technology officer who's a very close ally, but that's a very different function. And we think of the data work as very much allied to the strategy, and think of this as a data-led transformation role. If you think of it that way, then the allies that you gather are very different. The seat at the table is also very different. The empowerment is also very different. The investment that you're making, it isn't a technology investment. It is actually a data-led transformation investment for three purposes. It is to improve patient experience, it is to improve patient outcomes, and yes, it is to increase the sustainability of the business.
Perfect. I think we've had a wonderful discussion, and thank you so much, panelists, for your time and your presence, and definitely, bringing forth very pertinent insights and points that the industry as a whole needs to, look at. So thank you very much.